Hi everyone, in this video from Count Backwards from 10 we're going to talk about neurogenic shock, a specific type of distributive shock that gets its own video because the physiology is a little funky. We're going to discuss the actual physiologic problem, causes, expected changes in the variety of parameters you see here on the left, and my goal for this as well as all the shock videos is to ensure that you, the viewer, understands the main problem and the way the body attempts to compensate for that problem. That way you don't feel like you have to memorize these parameters but can work backwards to figure it out. So I've drawn the diagram we use for all the shock videos on the right. We have the heart, we have the arterial system which gets blood to our end organs. We have our venous system which is going to return our blood from our organs to our heart, and we have our central nervous system which is going to kind of control the whole thing. Now the problem around which all of the rest of this falls is located here in the central nervous system. Specifically the sympathetic innervation. As we know, the sympathetic nervous system has the colloquial name of fight or flight, which would do basically everything you would expect it to in order to prepare your body to either run or fight. These includes things like dilating the eyes to see more, dilating the bronchus and airways to allow better oxygenation and increased minute ventilation, but it's also responsible for major effects on the cardiovascular system as well, namely trying to increase blood flow to the tissues we need to run and fight. Normally this is done by increasing our heart rate, increasing our stroke volume, both of which would increase our cardiac output in order to provide our tissue with more oxygen. So if you understand all that, then you understand neurogenic shock. The take-home message is that in all of other types of shock, your body attempts to compensate by either increasing heart rate or your cardiac output or your systemic vascular resistance, anything to get blood to the tissue. But a neurogenic shock, it can't, at least depending on where the injury is. So as I mentioned in the distributive shock video, neurogenic shock is a little different but looks very similar. You'll see these mostly in the settings of traumas, spinal cord injury, brain trauma, and these patients, because they can't provide, that's the big problem, cannot provide sympathetic innervation to their tissue, to their blood vessels, to the muscles that surround their blood vessels to constrict, to increase their pressure. That's really what the overall problem is. So they have a massive drop in their systemic vascular resistance. Again, resistance is equal to resistivity, rho, times the length over the area. And as your area goes up because of unopposed vasodilation, your resistance goes way, way down. So our SVR has dropped. Because there's less resistance and there's distribution and fluids leaking out kind of everywhere, less blood is getting back to the heart, so your right atrial pressure and your central venous pressure drops, as well as the left atrial and capillary wedge pressure. Again, less blood's coming back, your preload is decreasing, it's unable to fill these chambers of the heart. Again, your ejection fraction goes down because the heart's inability to stretch and kind of starling force help pump that blood out. Now, the difference comes with your heart rate and your cardiac output. And as we talked about distributive shock, your heart rate really goes up in order to try and compensate for the leaky vessels. But the problem here is that depending on where the injury is, your body might or might not be able to actually compensate. And so the cardiac output and the heart rate will either go up or they won't do anything at all. The problem is thought that certain injuries at or above the level of T1 to T4. This is the level of the sympathetic cardio accelerator fibers. These are responsible for increasing your heart rate. And if the damage is there or above it, those fibers cannot fire and can't try to compensate here by increasing heart rate and cardiac output to get blood everywhere. Remember, cardiac output is equal to heart rate times stroke volume, and our stroke volume has gone down as a result of the distribution of fluid out of the blood vessels, and so the heart rate goes up to compensate to keep our cardiac output constant. So again, depending on where the injury is, there is either no increase or there is an increase in the heart rate and cardiac output. So let me go ahead and erase some of this stuff down here. Causes include brain injuries such as TBIs, spinal cord injuries, and treatment is basically supportive care until the underlying issue can be addressed. So pressors, fluids if need be, whatever you need to do. That's all for neurogenic shock. This is a special case of distributive shock. I hope this was clear and simple. As always, if you have any questions or concerns or interested in getting involved, please feel free to contact us. Subscribe below, follow us on Instagram for daily content, and stay tuned for the next video.